Hi, everybody. This is Gerald Ruiz, functional nutrition consultant here at the Natural Health Improvement Center of Idaho. And today we're going to talk a little bit of part of my seminar that I teach natural health practitioners across the country. It's called Nutritional Solutions for a Pharmaceutical World. So there are challenges with pharmaceuticals, and there's one category of pharmaceuticals that I really want to point out today. We're going to discuss birth control pills, right? Oral contraceptives. And this book is phenomenal. There are two books I actually recommend. The first one is The Pill. You can actually get a used copy online on Amazon. Really important read for anybody who's considering oral contraceptives. And just remember that these medications, these drugs, are intentionally inducing infertility in women. So oftentimes I like to train my colleagues to think about that these pills are drug-induced infertility pills, really. So of course they're branded for birth control, right? You are as a consumer are in control of your fertility. And in this book, it's really important to read through the first third because it actually exposes a lot of the common side effects and a lot of the common health challenges that they may potentially create for a individual who's actually going to be using them. Of course, then the next question that I have a lot of patients and even practitioners are wondering, well, okay, what are some safer methods to engage in birth control and prevent conception if you're not going to be going forward with something like the pill or an IUD or hormones or so it's important to understand why the body has the hormones cycling from, in the beginning, we call it the follicular phase, right? Why is there estrogen ramping up, leading to ovulation? And then why does progesterone come in on the second phase, which is known as the luteal phase? And why is the progesterone important for the implantation of a healthy embryo that's been recently fertilized, right? For having a healthy pregnancy. And so really understanding the female menstrual cycle and female fertility and female hormones. This is a book I highly recommend. It's phenomenally written. It's very simple. Anybody can pick it up. In fact, I wish it was a reading for every clinician out there during their degree and their training to help other people better understand their hormones and how to actually fix them. And so it's done very simply and explains, and the first third is really what people need to read. The first third is explaining about how the hormones move up and down and how there's the pituitary gland that's releasing luteinizing hormone, follicular stimulating hormone, and how the ovaries are responding during the menstrual cycle, and then how the adrenal glands are involved in the time after when someone has entered menopause, because the adrenals are still making hormones. And so a lot of individuals who become menopausal may have certain symptoms of hormonal imbalances, and it's really up to the adrenals. And so we find that when I work with individuals who are in menopause, it's their adrenals are still making the progesterone, still making the estrogen. And how do we support that, right? So any point where an individual is taking hormones exogenously, like they're taking it from the outside, whether it's a patch on their skin, usually it's in the lower abdomen, or they're taking oral contraceptives, or they're applying on the cream, that's all getting absorbed in the body. And then the own body's hormone glands are being told the message, you don't have to make it, right? And so we start to see over time natural suppression of these glands. And this is a phenomenon that all men know. When individuals who are taking testosterone as a supplement or as a drug, we start to see, men will notice that their testicles will start to shrink in size. And that's just because the testicles are atrophying. They are not having to produce normal levels of testosterone. And so then they start to atrophy, wither away. And this, in similar aspects, same thing will happen in women's hormonal glands, is that if they're taking the estrogen from the outside, then their own glands start to get suppressed, and only because they're not having to make those glands. Now, it's a little bit different because in women, the hormones change from cycle to cycle. So I do want to mention that when individuals start to work with us, we are taking a history on the actual menstrual cycle, because a lot of women think that not being regular is not a big deal, but it's important to understand the full moon cycles and understanding that ideally that we have the first day of one period to the first day of the next period. It's ideally 28 days. Now, it's more important that it's always regular. So if it's always 28 days consistently, that's better than having it being 26 days, 29 days, 27 days, 28 days. So as long as it's the same, right? So regularity is actually very important. Also, what we do is we look at symptoms that occur cyclically. So sometimes some individuals may have acne breakouts. It could be in the chin, it could be the forehead, it could be along the face, and that can occur maybe from 1 to 10 days before the period. So we always track to figure out at what point does the acne break out. Now, if someone has acne that's all cycle around, then there's clearly some liver toxicities. There's perhaps some heavy metals and chemicals that the body's having challenges eliminating, and that's why it's trying to come out through the skin. So going back to someone who has a cycle-related symptom, that could be acne, it could be also breast tenderness. So we'll be checking in, is it both breasts or just the left? Most of the women will have just the left, but sometimes it can be bad enough on the both. At the same time, we're going to be looking to see, is there any mood imbalances? So is an individual getting weepy, and how many days before the period? So sometimes it's 1 day, 3 days, sometimes 7 days, maybe 10 days before that. Sometimes people can get irritable. Sometimes it can be both. It could be one cycle they're irritable, another cycle they're more weepy and more emotional. And what this means is it's a different issue for each of the different ovaries, because women are actually ovulating from one ovary, and then the next cycle they ovulate for the other, and then alternating back and forth, back and forth. So if someone is alternating, if they're going from weepy from one period to irritable from the other, then each ovary has a different issue on their own. Sometimes I'll have individuals who have painful ovulation. So during ovulation, that's when the egg is released, and it's painful. And that can indicate there might be some cyst buildup, and there's pressure, and there's an egg trying to squeeze through and be released. And so sometimes that painful ovulation is only every other month. And that means that there might be potentially cysts on just one ovary. And we can have a medical professional go and conduct specific scans to confirm that. At the same time, we can obviously start to initiate some nutritional and herbal solutions to help normalize or support healthy ovarian function. Okay. Also, we're going to look at the cycle during a period if an individual has brown blood or clots. And ideally, we want fresh red blood always coming out. But if there's dark brown blood, dark red blood, or clots coming out, that means that the uterus is being used as a detox organ for the body, because the liver has some insufficiencies and it's not able to eliminate these toxins out through the bile and throughout the GI tract when we normally go and defecate, right? So if there is any clotting or is there any dark blood, that could be indicative that the liver needs some help. And most hormonal imbalances are usually going to be correlated or have some sort of contributing factor that the liver is a little bit sluggish. Okay, so there are ways that individuals can also track their health, their female vitality, and the health of their menstrual cycle. And one of the methods is using an app. There are many apps on there to actually track basal body temperature. So we know that estrogen will help cool the body's temperature down, and progesterone will raise it. And there's also some influence with thyroid hormone. And so when we start to see how the temperature moves up and down throughout the menstrual cycle, it gives us information on what's the body's capability of clearing and producing estrogen and clearing and producing progesterone. Now, we in our clinic will conduct saliva tests. Saliva tests is the best way. Over the course of a menstrual cycle, we'll have 11 samples, and we'll start to see how the estrogen and progesterone is moving throughout the 11 tests. Also, the tests that we use specifically are measuring the pituitary hormones, luteinizing hormone and follicular stimulating hormone, because we want to really understand if there is a hormonal imbalance, is it a problem with the upper hormone glands like the hypothalamus and the pituitary, or is it more downstream and it's the ovaries or the adrenals? So we're going to want to really hone in on exactly where the issues are. Now, going back to the liver is extremely important for female hormone balancing, because the liver breaks down the hormones when it's no longer needed. But also, we get exposed to so many xenoestrogens. Xeno means foreign, okay, and estrogen. We get these xenoestrogens or endocrine disruptors from our environment, so heavy metals as well as chemicals. And there are phytonutrients within certain vegetables, but it's really the chemical estrogens that can come in and start overstimulating the estrogen receptors and creating these hormonal imbalances. And so the liver becomes really key to clearing those out. I can't imagine, I can't count how many times I've had so many individuals come into the clinic and they've been using birth control pills or IUDs or whatever implants for maybe the depot shots, right? 3 months of hormone, synthetic progesterone for all in one shot, right? And then in the next 3 months, they get another shot. So imagine getting 3 months of a hormone injected for your body to deal with. And that's puts amazing strain on the liver. The liver has to clear that out. And so over time, it can get fatigued, it can get clogged, it can really become sluggish in terms of its ability to clear out these xenoestrogens and other chemicals that are mimicking. And this can lead to potential problems. I'm going to show you on screen too, that we have here. If you go and you look up the combined estrogen, progestogen, contraceptives monograph written by the IARC. The IARC is called the International Agency in the Research in Cancer. And you can go to the evaluation. So this organization actually evaluates all possible things that are somewhat hinted to causing various cancers and trying to understand it. And we go to group 5, go to section 5, the evaluation, and we see here that there is sufficient evidence in humans for the carcinogenicity of combined estrogen, progestogen, oral contraceptives. Combined estrogen, progestogen, oral contraceptives cause cancer of the breast, in situ invasive cancer of the uterine cervix, and cancer of the liver, right? So this is that connection between the liver as well as hormone imbalances. So if you know anybody who has a history of using oral contraceptives, or you yourself have used them, unfortunately, day in, day out, I'll ask the people we work with, the people we're treating, we're serving, our patients, none of them have ever had a medical professional tell them about the risks and the side effects of the use of these contraceptives. And it's unfortunate, but good news is when people come in, we can help their body eliminate those. Usually people stop the oral contraceptive and some of it still remains in the body. And so using certain detox or liver, kidney, gallbladder detox, lymph detox support, we use specific herbs and nutritional supplements to help support that process. That's usually the step number 1, right? Step number 1 is that. And then we start to see, do they have some endocrine weakness? Do they have challenges making sufficient progesterone or estrogen? And then we can start providing nutritional and herbal support to strengthen their pituitary, hypothalamus, as well as the ovaries and the adrenals. And that can be herbs such as shatavari, white peony, licorice, chase tree. You have black cohosh, kudzu, or epidemidium. So a lot of great herbs can help strengthen the endocrine system. But the first step is clear the xenoestrogens, the endocrine disruptors, with liver support, and then 2, start to feed with nourishing herbs as well as foods. So there are various glandular extracts that we provide to support the pituitary, the hypothalamus, the ovaries, and the adrenals. And then we also provide hormone precursors. So that can be found with blackcurrant seed oil, wheat germ oil, even having the patient consume more cholesterol so they can make more progesterone and estrogen from the cholesterol that's in their diet. The liver does make cholesterol for a reason, and we know that cholesterol is needed for the formation of steroid hormones, or these hormones that are relevant to female hormone balance. So anyways, this is some information. I highly recommend that you get these books. I'm going to put these in the links somewhere. You can look around so that if you know anybody who's dealing with any hormone imbalances, at least get those books, get informed, get educated, be in control of your hormones by understanding how your menstrual cycle works. And if you have any questions, feel free to reach out to us anytime. May you always be healthy and happy. And I look forward to seeing you on the next video.